That's my spiel. Genetic testing, metabolic disorders not to miss. Metabolic disorders not to mix will be amino acid ureas, and there is and then uric acid cycle disorders. Those are rare. They're often picked up in kids. So Ernest probably diagnosed many of them. They are, but you know, there is no easy way. The suspicion should be there when there is multiple different systems involved. So if you have musculoskeletal abnormalities, eye, brain, movement, plus epilepsy, plus other things going on. If there are many different things going on beyond movement disorders, then you should think of them. And but there is no easy way to test them. You have to do a whole panel of amino acid levels in the serum and urea cycle disorders, urea cycle testing for urine, and those are not cheap tests, but there is no way around it. Name of interesting common syndromes in movement disorder that we need to know. Interesting is a relative word. It may not be interesting to me if it's interesting to you. So common movement disorders, tardive dyskinesias, try not to miss them. Akathisia especially, don't miss it. With or without restless leg syndrome. Unusual presentation of restless syndrome, such as one limb presentation, just in the right leg, just in the left leg, that you should not miss. That can be very strange. Myoclonus can present in very, very unusual ways. And myoclonic dystonia can sometimes present and can look unusual. Task-specific dystonias. Sometimes patient complain of a certain task being difficult to do, but they look fine, unless you have them do that specific task. Handwriting is obvious, but there are other things. Could be musician's dystonia, certain, playing a flute or playing a guitar or piano. It could be golfer's dystonia, sportsman, tennis racket, tennis elbow, tennis dystonia, those kind of strange, unusual thing. You should not. Violinist dystonia, those can be unusual and can present, and you should not miss them. Ask them to do that certain specific task. What else interesting? Common dystonias, common disorders. Chorea, autoimmune chorea, and chorea with pregnancy, chorea gravidarum, and chorea with hyperglycemia, hyperglycemic chorea. These are often seen. So I have seen maybe 3 presentation in emergency of hyperglycemic chorea, where they weren't sure what's going on, and those choreas don't look like typical chorea. They're very weird, strange choreas. I've seen maybe 1 or 2 cases of chorea gravidarum, and I've seen 2 or 3 cases of autoimmune chorea. So that you should not miss, and they often present from hospital consult or ER consult, not clinic. These are not clinic presentations. They're acute presentations in the emergency or in the hospital. And talking about a hospital presentation, gabapentin-induced myoclonus, do not forget that in acute renal failure, in acute renal injury, acute AKI. So don't forget that. You will often get consult from other service, medicine or ER for that. That's interesting syndrome that I've often seen. What else? Bouncy gait, which is basically negative myoclonus of lower limb during gait. So that it's a very interesting and unusual that can be missed. It's just look for asterexis in those patients, usually liver failure. We have a very busy transplant service, liver transplant service. So we get often consults from them for gait problem, falls, and it's basically negative myoclonus of lower limb, bouncy gait. What else? I'll have to think gradually and other things will go up. So